Have you ever had a project that you'd like to get started, some seed money in your community, your church, your neighborhood, your organization, your state? You may not know this about AARP, but we have something called the Community Challenge Grant, and we have given over $386,000 out for that grant to get communities and organizations started. We're going to hear about some of them, so stay tuned. Thank you so much for being with us today, Maria and Sherry. You were the recipients of the 2025 Community Challenge Grant for AARP, and I understand that you have completed your project. So to help people understand what this grant does, why don't we start with you, Maria? Tell us a little bit about your organization and also what you did with the Community Challenge Grant that you received.
For sure. So I work for the city of Dearborn, and we are really focused on pedestrian safety, right? Specifically for walkers and bikers. And so we use this grant, kind of in conjunction with talking to our residents for illuminated stop signs and raised crosswalks, right? The idea being that, if you have to walk to the doctor's office, you want to walk to the park, you want to walk your grandkids to school, you should be able to do that safely.
So illuminated stop signs. That means that you can see them morning, noon, or night. They're lit up so people can see them very easily and know that they have to stop.
100%.
Fantastic. How did you come up with that idea?
So it's a part of a health in all policies approach that Mayor Hammoud has taken on, right? Being that health is in every single aspect of city government, right? So we've been working on this, looking at our crash data, and then someone brought it to us that illuminated stop signs would be a good response to this, right? We actually have a very young population, right? About 25% of our residents are seniors, but about 40% of our population is under the age of 19. So they're getting their keys for the very first time, right? That combined with distracted driving, combined with a zillion other things that they're dealing with, we want to make sure that the stop signs are clear and obvious, so that way, not only do they stop, but people have the confidence to actually be able to walk safely across the road.
And especially, particularly if you have that kind of diverse geographic community, or
100%.
Children, strollers, walkers, from the walkers to the strollers, people are trying to cross those streets, right? Yeah. Fantastic. How did you hear about the grant?
So we've been doing some work with AARP before, right? We're very involved in the United States Conference of Mayors, which AARP is a member of. So I spend a lot of time with Nancy and Mike Watson. They've been so great about letting us know about the different programs that AARP has to offer.
Fantastic. And Dearborn has been a model city for all things innovative.
Well, thank you.
Yeah, you've just been done a phenomenal job. We'll talk more about that in a moment. So tell us about your program and what you did, Sherry, with your Community Challenge money.
Sure. Interfaith Volunteer Caregivers is a nonprofit, and we serve low-income seniors and disabled adults with the help of volunteers. So we're already going into our seniors' homes and helping them with transportation and with housekeeping and yard work and friendly visits. So we have a database of people we know already need help.
Nice.
So using this grant money allowed us to go in and offer safety things that they could use in the home to make the home safer.
So give us some example of what you offered.
Our volunteers would go in with kits of things, and it turns out the biggest hit was the lights. So night lights, brighter light bulbs, those push or tap lights that go in closets or under sinks were all very popular. But so were the grabbing tools, the double stick tape to keep rugs down. There were lots of
So that's pretty neat. So you already have a database of what people need and what they want. You just have to find different ways to, or people who have needs. And you have to find ways to fund that and to help support them. And so this grant helped you to be able to help those older adults and seniors who need it.
Well, typically they come to us and say, I need a ride to the doctor. But they don't come to us and say, I need to make my home safer. So they're coming with bigger needs, and we were able to turn around and say, now that we have this grant, we can go and help you with other things that you didn't even realize would make your home safer.
Did you have any idea that AARP even had anything like a Community Challenge Grant before you?
No, I didn't.
Yeah, you thought we were insurance and discounts. That's what everybody thinks, that all we do is sell insurance. I've been here for 12 years. I've never sold one insurance. I've never, sold a membership on a discount or any of that. It's this kind of work that makes a AARP in the community so valuable.
Sure.
So tell us how you learned about the grant.
Well, my director has been the director of our organization for all 34 years of its existence. And she used to do grants herself, but since I've been there, she's been funneling things to me. And she said, hey, take a look into this and see if this is something we can do. So she was the one who sent it to me.
Fantastic. And this isn't just about the organizations. You get community involvement. Both of you are talking about the needs of the community. So tell us a little bit about how they were involved, how they were engaged, and how you sort of listened to their needs in order to respond, and the size of your grant. Maria?
Yeah. So we have 5 senior housing buildings in the city, which are underneath the umbrella of our Department of Public Works, right? So the people who are doing the work, there's a very, very strong connection, right? So they meet pretty actively monthly. So they're telling us where the needs are, in addition to our Senior Citizens Committee, right? So they have a direct line to our city council, to our team.
Whoa. You have a Senior Citizens Committee that meets monthly for the city of Dearborn? I'm moving.
You should. We have great coffee and great food.
That's fantastic. So they really are listening. I mean, every community out there, Dearborn has a Senior Citizens Committee that meets monthly and informs the city of what their needs are. I love that. Go ahead. I'm sorry.
Oh, no, 100%. So all that to say, I mean, I think that accessibility, to your point, is so important, right? People know how they can reach us. They know how they can have their voice be heard. And I think also going back to social media, right? We're very social media focused as well. So people know that they can message us, that they can have their voice be heard on there. They know what events we're having. One of the great things about the city of Dearborn that's kind of unique is we have neighborhood liaisons, right? So people who are with the city team, who actively are out in their neighborhoods, right? So a lot of people know Silvio Davis because he's their neighborhood liaison. So if they need something and they don't know where to go, they're going to go to Silvio first, and Silvio is going to be able to direct that. So it's a really great opportunity.
How did that get started? Who started that?
The Neighborhood Liaisons program?
The Senior Citizens Committee and the Neighborhood Liaison both.
Oh gosh, way before my time.
Is that right? It's been going on for a long time.
Yeah.
That's right. So even with the changes of administration, they continue to have that program. It shows the value of it, that it's not just a one and done or it's based on one particular leader, but
right. I think that's one of the ones, all of our commissions usually have a council person that's also engaged. I think that's one that they kind of all try to vie for, just because, you want to be there and have those engagements and kind of hear what's going on in the community. And no one knows better than seniors what's going on, and they will tell you, which is great.
That's right. And you want seniors in your community, wherever you live.
100%.
It's nice to have that kind of diverse, multi-generational, but you want some older folks who are looking out the window and knowing that person doesn't live in this
100%.
block. So you want that. So fantastic. And what about with you? How did you get neighborhood and communities involved? And well, you already said that you've got a whole database.
Right. We serve 3 counties in Metro Detroit, so Macomb, Oakland, and St. Clair counties. And we have a lot of organizations that refer people to us, and a lot of cities themselves will refer directly to us. We have a senior citizen who needs some help, maybe you can help them. So we get phone calls all day long from people who need help, and some we can help and some we can't. And then we also get referrals for volunteers who want to help. I have extra time, I just retired, I'd like to help some seniors who are worse off than I am. So we get lots of phone calls all throughout the 3 counties.
So when you say interfaith, is it multi-denominational, different denominations are involved, or is it a particular?
Nope, it's all faiths or even no faith. When we started 34 years ago, it was really just a group of religious leaders from all different types of religions. So we find it's a good way to get volunteers through different churches.
That's fantastic. So we've got to talk more, because there's some other things that we can probably do to help with that as well. So people have this misperception of who we are and what we do. And of course, you see all the ads about United Healthcare or whatever the other insurance, and you see the discounts. But in communities, in the States, AARP does exactly what you're talking about now, whether it's caregiving, whether it's fraud, whether it's advocacy, lowering prescription drug prices. And people don't know that. So it's really nice that you're here to share your stories. And this is something that we do every year, so communities can apply for that. I think the number that AARP has given out throughout the country was something like $32.6 million since this program started. That's a big chunk of change. And so we're so happy that you all have been able to find some use for that. Talk about the size of your grant, because they range. It can be from $2,000 to, 30,000 or whatever it might be. So what was the size of your grants?
Mine was $19,000.
$19,322
to be exact.
Hey, is that exactly what you asked for?
Yeah. So combined with, the illuminated signs, the stakes, the labor that was involved. And what I love about this program too, to your point about all the different impact, is that it's scalable, right? Like we did it as a city, but then we'll have our crash data, we have our feedback from our seniors about how it actually worked, and we can share that with other cities, right? There's no proprietary knowledge on this kind of work. We can share it with anyone who wants to use it.
So that's good for people to know who are listening if they want to do something similar to that. And there's some 100%. Pictures that we're showing, photos that we're showing of the actual design and what happened, but other communities people who might be, and it's not the city leader who has to elevate this.
Exactly.
Like you said, it's the Senior Citizens Committee and it's the database that you have of people sharing what their needs are. So we sometimes forget the power that we have as citizens and residents of communities to lift up issues that are important to us. What about with you? What was the size of your grant?
We received a micro grant, and that's $2,500, which allowed us to buy the supplies because we used volunteers to take it into the homes. So really all of that money went to buying the things that we left behind with the seniors.
I love it. What else are you hearing from seniors that they need? What kinds of things? And you said the transportation is one that they need, and then the products that you provided to them. What else are they in need of? There might be some philanthropist out there who wants to give you whatever you need.
That would be wonderful.
So let's tell them
what they need. There's a little nonprofit. We're looking for any philanthropy we can get for sure. Transportation is the biggest one. People stop driving pretty quickly because of either sight issues or other issues. So they always need a ride to a doctor, especially now that everyone's got so many different doctors they have to see instead of just one doctor. They also need to get to the grocery store. Like, I can shop in the store myself. I just can't get there and home with the product. So volunteers do those kinds of rides as well. But housekeeping is big. Laundry, cleaning the bathroom.
Activities of daily living.
They just get more difficult, right? But to stay independent, instead of going to assisted living, this gets to keep them independent a little bit longer in their homes, just having a volunteer help.
I'm so glad you said that, because one of my big bugaboos is that we've done some research, Kellogg Foundation did some research, and for every dollar that the state of Michigan spends to send someone to assisted living, with Medicare, Medicaid, or whatever, they could save $2 if they just assisted them at home.
Right.
They could literally save money. Too. So it's not an entitlement or asking for more money, but people want to age in place. They want to age at home, and just a little help like your organization's doing, and like they feel safe. And one of the things people don't realize about older adults, they contribute to the community. Economically, they help the community thrive, because whether it's hospital bills or doctor bills, or whether it's transportation or grocery store or dinner or whatever, so you want them in your community. How hard was it to apply? Was it like reams and reams of pages that you had to apply for this grant? Go ahead.
No, but I would, for anyone who does plan on applying, especially for a city perspective, I think cross collaboration with other departments was really critical, right? Our police department was involved in this grant, our DPW was involved in this grant, Philanthropy and Grants was, having those neighborhood liaisons give us their feedback. So it really was an all hands on deck, but a very quick, as far as the paperwork goes, that was really simple and streamlined for us. But that was
people
great.
Need to know, because sometimes, when you hear the words grants, you're kind of like, oh, I got to get a grant writer. That's going to cost me money. I've got to get all this research. It's going to be worth it. But the process is pretty simple, right?
For sure. I don't have that kind of a background in grant writing, so I've only been with this organization a few years, and I was able to write the grant for us and win it, which, made me feel pretty good.
Right, it probably gave you a little bit of a bonus too, getting a grant, a big 25 hours, a $2,500 grant. Yeah. So when you think about older adults, think about community challenge grant, what is it that you want people to know about the community challenge grant? If they're interested in it, what would you share with them?
Oh, to definitely look into it. If you belong to an organization or a city or an entity that is one that can apply, go ahead and do it for sure.
Fantastic.
Yeah.
That and involve your community, right? Get that feedback, hear those stories, like be with people, boots on the ground, because I think that definitely makes the grant more meaningful, right? More authentic than just saying, oh, we know that we need stop signs. Where do we need the illuminated stop signs, and why do we need them there? It's because they're going from their senior living community to Dearborn Fresh, which is one of our local grocery stores, which is where we put one of those stop signs, right? Because of that feedback. So I think that's also really important.
Do you have something else in mind? I mean, we've given out, I just love hearing about the projects. When I think there was over 150, 60, 30, I don't remember the number of grants, applications that came in. And I love hearing about the projects, because you find out how invested people are in their communities. I mean, everything from here in Lansing, they did a whole gymnastics place right by the river. So old for it's multi-generational playground. So grandparents can come and there's something for them to do and bring their grandkids and something for them to do. There's been murals on the walls or sidewalks, like you're saying, just a variety of projects. And people are so invested in their community. And it's nice to be able, just a little, look, you said 19,000, 2,500, whatever the amount is, to help kind of give them a little bit of a push to make that happen. What's your next project?
Oh gosh, so many different ones. I guess just to talk a little bit about it. So I'm also the acting director of the public health department. So one of the things,
Dearborn.
yeah,
I'm moving.
the most. But one of the things that we're doing actually with a different grant with our senior housing communities. And one of the things we talked about on the way in is loneliness is such a huge issue for our seniors. And so we're working on some movement related programs, right, to go into our senior housing communities, right, and how those different active dance classes, movement classes, make sure they have an opportunity to connect and get fit and healthy together.
Nice, very nice, excellent. What about, got something else in mind?
For us, it's more the same.
Yeah.
You know, we know what the needs are, and just finding the volunteers who can help in all the different areas. We are expanding further into those other counties. You know, we're pretty heavily into Macomb, but to get further out in St. Clair and Oakland counties, that's probably our focus next.
How do people find out about you and what you're doing?
Well, lots of different ways. We do get out into the community quite a bit. Okay. So we're at markets and different senior fairs and things, because we're looking for people who have the time to volunteer. But they hear about us through our grant funders, who then refer them to us when they see that we can fit a need.
Fantastic. And how do people find out about your senior senior committee?
So many different ways. We have a city magazine, which is great. It gets mailed out to every single resident, but we have a lot of companies now that are taking us up on sending it to them or sending them the electronic version. Of course, social media, right? Mayor is heavily engaged in the community, so he's at every single coffee talk, walk, neighborhood walks especially. So we advertise those regularly, that we're going to be in your neighborhood. We're doing a cleanup, right? So I'll go out on a Wednesday or Thursday when I have some time, join the team, get a litter picker, just going around. But people know that we're in their neighborhood, right? So if they have a concern or question, the mayor's right there and they can walk right up to him and say, hi, I live at this house and this is my concern. So very, very accessible.
That's fantastic. What's on the minds of seniors, older adults? What's on their minds? What are you hearing more? I know you talked about social isolation being an issue, and I think even since COVID, it's been exacerbated even since then, and particularly in the winter months, right, when people can't get out and transportation's an issue. But as you talk with communities and older adults particularly, what are they most concerned about? And let me put it this way, this is an election year. So if you could push a button and say, older adults, Mr. or Mrs. candidate, really want you to X, what would X be? Go ahead, you're looking, you're ready.
No, I'm really just trying to think.
Yeah, they're concerned about something.
They're concerned about paying for things.
Yeah, affordability.
Right, their income is pretty limited, and it goes to pay for things that are necessities, which doesn't leave them any extras for a surprise trip, that they need to pay for, or like to the doctor or anything, transportation. They just don't have the extra money. Or for like what we did, the safety supplies. They're not going to go to the store and get flashlights and push lights and make their house brighter, because there's just no extra money for that.
Yeah, so the affordability issues, the pocketbook issues.
Very
and
big.
Some people might see it as being extra, but it's a safety issue, as you said, for them.
Sure.
I mean, I use that little light when I go, the one that you plug in, the motion light that you can just plug in.
Right.
I take that on me when I go on vacation, different hotel rooms.
Right.
Yeah, I can only imagine how important that is for folks.
And that's just very low on their priorities, because their money's used up before it gets to that.
Exactly, yeah.
I'm going to go back to public safety, but I have a reason for that. One, I think it is the biggest issue for seniors just across the board, at least what they're telling us. But I think the great thing and how it connects to this grant, right? This was a demonstration grant for us, right? So we're able to use the data that we collect, the feedback we collect, to demonstrate why we need more of these things, right, in the city, why our council should invest. So after we got this grant, one of the things that we did apply for and that we're hopeful to receive is some significant millions of dollars of funding for more raised crosswalks, for more illuminated stop signs, for hawk lights in the city, specifically focused on our school areas. But to your point, like, they help everybody, right? Of all ages, when you have better pedestrian safety improvements, and especially if you want to walk your grandkids to school, right? It needs to be a safe experience for you to have.
Good for you. We hear that all over the state, with safety, social isolation issues, affordability issues as well. It's one of our big projects is making every community an age-friendly community. And it's not just for older adults, but like I said, from someone carrying a stroller and a toddler going across the street, you might need more than the 24 seconds that the light gives you. You might need a little longer for both multi-generational people living in that community. So we just appreciate so very, very much the work that you're doing, everything that you're doing to help to help just your communities and build stronger communities, age-friendly communities, communities that work for everybody. That's what we're talking about. Thank you so much for what you do. Appreciate you being here on Real Possibilities.
Thank you.
Should you put your children on your trust, on your bank account, on a will, on a deed? Let's ask David.
So what you're talking about, the way most of estate planning is done, is what we call blunt force planning.
That doesn't sound good.
No, well, sometimes it works.
Yes.
It's not like it never works, but nobody brags about the time when it blows up in your face and leads to disaster. So that's the cases that I see, right? But if you did it, and this is how we do it, we think about what are the likely things to happen. When you put your kid on the insurance policy, on the IRA, on the bank account, oh, I avoided probate. Yeah, congratulations. But now your kid is going through a divorce, or they were in a car accident, or they have student loan debt that they co-signed for your grandkids to go to college, right? There's all kinds of ways, especially in this world, where people wind up with liabilities. And if you just blunt force deliver the money to them when you die, there goes the money. Instead of the inheritance being a nest egg, instead of the inheritance being a stepping stone to the future, right? It just goes to pay off the past mistakes. And you have all the power when you are making your estate plan to be thoughtful, to be considerate, to be appreciative of the world the way it is. If I asked you, I mean, has your life been a straight line since high school?
Absolutely not.
Whose is?
Yeah.
Nobody's like that, right? Things happen. But when you do blunt force planning, which is what is very easy to understand, it's what most people are doing. When you do blunt force planning, what you're telling me is every day's a sunny day. Nothing will ever go wrong. My kids are perfect.
And that's just not true. Thank you for that, David. I appreciate it.
Thank you, Paul.
Blunt force planning.
Blunt force. You don't want to do that.
All right. You've worked hard for your money, and you're hearing more and more about scams, and the more intelligent scams are out there. So let's talk a little bit about scams as we talk about retirement and our financial security and what should we know and how do we protect ourselves. You know, we've earned this money. We want to keep it. What do we need to do?
Yeah, I appreciate the question. It seems to be coming up more and more often, doesn't it?
Yes, absolutely. It's scary.
Yeah, I would agree. I would start with trust your gut. If it doesn't seem right, it probably isn't. And trust in the counterparts, the professionals, the friends, the relatives that you have. Ask folks, hey, does this sound legit? Does this look legit? Because it does happen more and more every single day.
Are there ways to protect yourself? I mean, we hear things about people's deeds being stolen, and 10 years later, you know, they find out that they don't even have the deed to their house, or their investments have been attacked and they don't know it right away. Are there ways that you can protect yourself from those types of scams?
I would start with don't respond to anything that doesn't appear to be original from the sender, right? It's that first layer, that first level of approach. You know, the IRS is never going to call you on the phone.
Right.
You know, don't answer those.
Right.
Oftentimes, pause, say, I'll call you back, and then just make sure that the phone number you find online or on your bill is directly attached to the person that's calling you. You know, that first line of defense, that first level of awareness, if you will, of this doesn't sound legit, would be the first place to prevent problems from occurring.
And people should avoid putting too much information on social media as well, right?
Yeah, it's generally a good practice, I would say.
Yeah.
The less somebody else knows about you, probably the better.
Yeah, that's why I'm a private person. I don't do TV or TV.
Right.
Thanks for being here. Appreciate that information. You know, my mother always told me never to get in the car with strangers, but that's not true when it comes to CATA and the bus drivers, right?
That's not true.
Thanks for being with us today, Trista. Tell us a little bit about the drivers and the accessibility of the CATA vehicles.
So being in a wheelchair, you wonder how you can get in and out of things. They have buses that have a lift on them. The lift comes down, you ride right on, it puts you on the bus. They lock down your seat, even if you're in a manual wheelchair or a power wheelchair. Even if you use a walker. If you use a walker, they can put the lift down and you can get on the bus. They have vans that do the same thing. And from what I understand, even the big buses, the line buses, lower down so that people in wheelchairs can get on. There's no reason to have to stay home. There's so much public access through CATA. The drivers are amazing. They speak to you most of the time. Like if you want to be a friend, you have to be friendly.
Right.
So when you get on the bus and you say hello and you remember to say please and thank you, you're treated very well. And like I said, they come to your house and get you. That alone is
Absolutely.
a plus, you know.
Absolutely.
Everybody won't come to your house, or, you know, they might make you go 3 or 4 blocks away, but they will come right to your door. They pick you up, they wait for you, and they bring you right back.
And a lot of people don't know that those services are available and that the drivers are as friendly and as helpful as they are. So it's good for people to know that. How many years have you been using CATA?
Almost 5 years.
Wow, wow. And what advice would you give to people?
Try it. If you have not been on the bus, try it. You will love it, and you'll be on there every day like I am. Sometimes I go to 4 and 5 different places in a day. It's amazing.
No parking, no gas, none of that. So
No
thank
insurance.
you. No insurance. Thanks for being here with us today. Appreciate it.
Thank you so much for having me.
I'm Tracy Anderson with Impart Alliance. Today I'm joined by Bethany Dizer. Bethany serves as our Associate Director of Impart Alliance, and she also oversees our training. Bethany, can you tell me a little bit about the opportunities that are available for employers of direct care workers?
So right now we are offering free direct care worker training to direct care workers across the state of Michigan. It's a great opportunity for employers to access training from our programming for their employees. And we know that direct care workers want more training. In surveys asking direct care workers about why they want to stay or leave the profession, very often they cite feeling a lack of support, inadequate resources, and not being part of the team at their workplaces. So what a great opportunity for employers to show support and also build skill and knowledge in their employees to help them do excellent work.
And what is the best way for employers to reach out to Impart Alliance for these opportunities?
So employers are certainly welcome to email us directly, contact us through our website. Our virtual training program is live. We have classes being offered every day of the week. They can assist their employees to create a profile, register, and sign up for some class times. We know direct care workers work all different shifts, all different days, and we try to make our classes available at different times and different dates. But we also have an option if you're an interested employer and you want to train one of your seasoned advanced direct care workers to become a trainer and deliver our standardized curriculum to their colleagues in your organization. We have a program that can help you facilitate that. It's a great career opportunity for those direct care workers, and it's a great way to incorporate training as part of your workplace, as part of onboarding, as part of advancement and decision making.
Sounds like a great opportunity. Thank you, Bethany.
Of course.
See, you thought you knew all about AARP, but if you didn't know about the Community Challenges grants, then hopefully you learned something today and you'll share it with people that you know. Thanks for watching Real Possibilities.